Today we are going to talk about different types of long cases you might get in your exam or you might see in day-to-day clinical clerkship in medicine. One of the common types is acute diagnostic problem. Now these include a previously healthy person with a short-lasting fever with lymphadenopathy on examination and pallo and splenomegaly perhaps. Or this can be acute onset polyarthritic illness with cardiac murmur and fever. So basically this type of cases are diagnostic problems, and the bulk of the history has to be focused on taking a detailed history in order to come to a diagnosis, arrive at a diagnosis. Of course, management will be discussed in the relevant part, but bulk of the history, because this is a short-lasting and acute and illness, is focused on the diagnostic issues. So you will have to go dig deep into different components of the history and be ready with a plan of investigation for the management and the differential diagnosis. The second type is chronic illness or illness which has been there for some time, which is causing illness, acute exacerbations or acute hospital admissions from time to time. For example, diabetes fall into this category, where the patient has to get admitted with either hypoglycemia or hyperglycemia or numbness of hands or feet or some vascular complication like myocardial infarction or stroke, that type of thing. So as you start the long case, patient will say that I have diabetes. So the diagnostic problem is solved because we know that this patient has diabetes, right? And so it is up to you to, then there's hardly any diagnostic dilemma in that. You know that it's a diabetes. But what are the issues in managing diabetes? You have to get into what are the problems this led to hospital admission, and what are the problems which are not acute at the moment but has to be managed properly, which has not been managed properly in the past. So you have to focus more of the management part. So that is a chronic problem. The third category of the chronic illness may be the first presentation of a chronic illness. You know that this patient is going to have a long-lasting illness or long-lasting effect on this patient's health as a result of the diagnosis of this illness. For example, again, diabetes, systemic lupus erythematosus, rheumatoid disease, and there may be so many, and chronic liver disease, again, chronic disease, chronic kidney disease. All these are the first presentation, but you know that this patient would face several effects of this illness in time to come. So you can categorize your long case, in my opinion, into one of the three types of illnesses. Acute diagnostic problem, more a diagnostic problem, there is some management issues as well. Recurrent chronic problem, where a patient gets admitted with one of the complications or several complications, or the first presentation of a long-lasting illness or chronic illness. So these are the three types you can put any of your long case problems into for the purpose of taking history, writing up a management plan and discussion. Right. Now if you happen to get acute diagnostic problem as your long case, for example, when you go to the patient and ask what is wrong with you, you must first ask, rather than asking what is wrong with you, when he says, yes, I have fever, I have joint pains, I have swelling of feet, and then you have to make sure the patient has been previously healthy. When was he healthy or not feeling unwell at the last time? So onset you have to decide whether it's a onset is very sudden. Sometimes certain diseases have a very sudden onset, myocardial infarction for example, and a stroke, so very sudden onset within minutes. And certain illnesses have over several hours, breathlessness developing over several hours, and certain illnesses, their symptomatology develops over a couple of days. So make sure the patient has been last well on this occasion, and the onset has been very acute over minutes, over hours, over days, and the progression of the disease from the time of onset has been gradually worsening, static, or getting better, again coming back, that is recurrent. So you have to decide what is the time course of the particular symptom which led to hospital admission. Just like when you ask about pain, you first ask onset of pain, and after describing the character and radiation and all that, you have to describe the progression and what has been done at each occasion. Maybe at home remedy what has been done, at the private practitioner or general practitioner what has been done, and at the emergency treatment unit what has been done, and at the ward what has been done, and what is the situation now. So you have to describe the time course in most of these acute cases. And other components, here the diagnostic problem, so other components you have to go into detail depending on the content of the history. If it is a chest pain, in a middle-aged male, you have to go into other risk factor, inquiry into risk factors, family history, and so on and so forth. Febrile illness, the contact history and his occupation, and things like that. So I'm not going to discuss each and every case, but I'm just telling, if you happen to get a patient who has been previously healthy, who has been admitted with an acute illness, and you have to make sure what was the onset, what is the progression, and what has been done from the time of onset of the symptom up to the time of you taking the history, not up to the time of admission alone. It has to be a detailed account, but need not be written word by word. You can always jot them down. On the day 1 this happened, and at OPD or ETU this happened, in the ward this happened, day 1 after admission this happened, today is the day 5 after admission, and what has been done. So you need to describe them after jotting them down or after noting them down at the important places. If you think that the second day has been totally uneventful, you can mention that. You don't have to say every hour and hour basis if there has not been a significant thing. So that has to be detailed in a acute illness, which is a diagnostic problem, other than the inquiring into the different components of the history. The second category of long cases include chronic diseases with recurrent hospital admissions. So if you happen to be given a case of chronic liver disease which has been diagnosed several years back, or diabetic diagnosed long years back, or person with polyarthritic illness, probably a rheumatoid, something like that. So here, when you start the history, as you go near the patient, you can ask, have you got any disease which has been diagnosed in the past? Or they might say, what's wrong with you? Is that I have diabetes. As you can see the patient, that it's a spot diagnosis. Sometimes the chronic liver disease are often for a final year student. Patient is edematous, icteric, and all peripheral stigmata of chronic liver disease. So as you arrive near the patient, this has to be either chronic liver disease or chronic kidney disease. So you can ask the patient and verify further. Or nephrotic syndrome is also similar, grossly edematous person, likewise. So there's hardly any diagnostic issue, but there are problems in the management. So here, one mistake that students often do in this sort of patient is they go into the first episode of the diagnosis of a particular illness, and from there they narrate or they describe. He was diagnosed to have diabetes 15 years back when he got admitted for a wound in his right leg with blood sugar of 456. Often this is unnecessary. So you can mention his diagnosis of diabetes dates back to 15 years. Since then, he has had several hospital admissions. What sort of a follow-up, either at a tertiary care hospital or a primary care level, village hospital, or general practitioner level, or whatever thing you can. So it has to be again presented in a sort of summary, like rather than each day. And he has had several hospital admissions from the time of diagnosis, and with this sort of complications, those has to be included in the past medical history, of course. But in the history of presenting complaint, they need not go back to the first episode and describe from their each step or each year up to the time now. That is totally unnecessary, and that will take up a lot of time of your 10 minutes, your time that you should spend in presenting. So you must know how to spend time more effectively. So when you get a patient with a chronic illness, with recurrent hospital admissions, recurrent complications, you need to spend your time very, very cautiously, so that you will not over describe something in the past which is unnecessary for the present admission. All what you need to say is the patient had been diagnosed to have this illness long years ago, and since then he has had follow-up, what sort of a follow-up, what sort of a hospital admission, what sort of complications, and what is compliance, and what complications he has developed, that sort of thing. So you have to be aware of the time factor when you are dealing with a illness, chronic illness, which has a fairly long history. So you have to get prepared, get used to it. You have to, when you in the preparation phase, you have to present different types of each of these patients, so that you will get a good practice of presenting this type of cases. The next category of long cases you might get is a chronic problem, but the first presentation. So therefore, it includes a diagnostic as well as the management issues. You might consider this as the more difficult of the three types, because you have to make a diagnosis what this long-standing illness is, and then you have to focus on the management at the time of a diagnosis and subsequent follow-up management as well. So your knowledge component has to be a little more broader in this situation, where you have to have a diagnostic skills and the testing and all sorts of things, and the management. And so these sort of cases, patients sometimes deny, and patients may not be aware what he was diagnosed to have. So be careful. Often students go and ask, are you aware of any diseases where you are told that any illness that you're having? Naturally, they might say, yes, I was told to have diabetes, I was told to have cirrhosis or chronic kidney disease and whatever it is. But these sort of cases, patients may not be aware still, because he was diagnosed to have this particular condition only a couple of days ago. And even if he was told, but sometimes they may still be in the denial phase. So they might not know. So be careful. When you are inquiring, when you happen to inquire from the patient what's wrong with you, he might say, I only have swelling of legs, and even though it is cirrhosis, even though it is heart failure, even though it is chronic kidney disease, patients may not be aware. So you have to make a diagnosis based on the other features in the history and examination, and other components of the past medical history and so on. So basically these are the three types of cases that you might get as your long cases in an exam. And all these three types, there's another important aspect that you have to go through other than going through the components of the history. You know that you have to go through the past medical history and the drug history, occupational history, and blah blah. Based on the particular case, you may have to spend more time on a particular component in some cases, and some cases particular component may not be that relevant. So you have to select what component has to be dealt in detail and what component has to be just brushed aside or hurried. And at the end, or rather somewhere in the history, you must also pay attention. A new, sorry, it's not new, but the acronym may be new. The ICE of a long case. What is ICE? ICE is the patient's ideas of the illness. That's important in the managing, especially a long case, sometimes in a chronic case, but sometimes in acute illness also. And patient's concerns and patient's expectations. So you must ask, depending on the patient's educational level and all, what do you think? What do you think that you are having now? He might say, yes, I have this, and he may be very depressed. So his concern is, can I get back to my work soon? His concern is that, can I be with my family soon? Can I start my occupation soon? How soon? That's his concern and his expectations. So those things has to be also mentioned in the most of the long cases, because this is final year. This is just not just going through the different component. Impact of his illness on his day-to-day life has to be inquired through ICE, ideas, concerns, and expectations. So that will fulfill the different types of the long cases. And if you happen to get a long case when you happen to get your long case in your exam or in the final year clerkship, first make sure what type of a long case you are dealing with, and then according to the type, you may have to switch gears, or you have to bet on based on the type, whether you have to be prepared with a list of investigation if it's a diagnostic issue, prepared with the management of a different complication of a particular disease when it is a chronic illness, and prepare with both when it is a chronic illness which is presenting for the first time. So when you go to the long case interview, you better make a small list of these are the investigations that I would do at the first go, and that's a second line investigation these, and these are the investigation I would do for this particular complication to confirm it, and these are the management protocols that I would recommend for this patient. So be prepared. That's the whole idea of going through these sort of small videos, to give you an idea that long case examination with good preparation can bring you good results. Thank you.